Hello, my name is Stephanie Narbaez, and in this video, we will go over the different types of communication one may encounter within the allied healthcare profession. We are first going to discuss and identify the principles of scientific communication. There are several principles to follow when communicating scientific data, and the approach to translating such communication may slightly differ between groups of people. For example, you would address the public differently than you would a group of scientists. But still, here are a few principles to follow when translating scientific data to answer evidence based questions. Number one is to be prepared by being confident with the information that you are sharing. Number two is to use only valid and reliable empirical evidence that was gathered through qualitative or quantitative techniques. Number three is to be honest and transparent about how the data was collected and analyzed, including the limitations the research may have had. In addition, discuss the ethical considerations of the participants throughout the research process. Number four is applicability. Use only the relevant information for the practical application of data. This uncomplicates the facts by focusing on essential details to guide in decision making. Number five is to engage with the audience by showing enthusiasm and passion about the research you are presenting. Include education in your presentation to assist your audience with unfamiliar terms and use clear and concise language. Number six is know your audience. Tailor the message to the level of understanding and education of your audience. Avoid jargon or terminology the audience could not understand or relate to. For example, if I were presenting research regarding a new surgical procedure, I would use appropriate medical terminology with explanations instead of abbreviations or acronyms that the operating room commonly uses. Our next point is discussing ethical implication in human research as it applies to the healthcare profession. When performing research using human participants, measuring the ethical implications of the research process is essential. An individual's values and rights include their freedom, dignity, and bodily integrity, and should be considered and maintained throughout the research process. Within allied healthcare, protecting an individual's values and rights is called informed consent, which is performed by getting the appropriate permission from the human research participants, proving they understand and acknowledge all aspects of the objectives and the purpose of the research. All research participants must have the right to be informed of all risks and benefits associated with the research process, and the right to abandon the research at any point. Participants should never feel coerced to take part in any research. Research details must be communicated according to their level of understanding and education. Participants must be able to reiterate the requirements, responsibilities, and expectations of the research process. In addition, participants must have the right to be educated about the process details and fully understand the research goals and objectives, and be informed of any changes made in the research process. Research participants also should be valued as a whole, which is their body, mind, and spirit, and participants shall not be exposed to any testing or procedures that could cause damage to the mind, physical body that would cause distress, humiliation, or degradation. And lastly, participants have the right to privacy by protecting their personal information and using all necessary measures to ensure their identity is kept confidential. Our next point in communications, we're going to discuss the ethical issues around communication when conducting research in the allied healthcare field. According to the article Ethical Issues and Research by Drawlett et al. In 2023, the ethical issues surrounding communication in research include research integrity, conflict of interest, lack of collaboration, and social injustices. Research integrity issues can include the exaggeration of findings, which falsifies the validity and reliability of the research. Number two is the conflict of interest, can involve either interpersonal conflict with either research participants or the research team. An example of this can be falsifying answers on a survey for research to get the desired results or to receive desired funding. Other conflicts of interest can disrupt honest communication are financial partnerships, third party pressures of academic or economic interests, a researcher who holds multiple roles within the research process, or incentives that influence a researcher's independence, integrity, neutrality, or the research project or incentive. Next is the lack of collaboration. At times, a research process is rated based on independent performance. Therefore, there is a lack of communication and collaboration between researchers. Next is social injustices. Research input or research findings, hypotheses, or research data may be dismissed based on an individual's race, sex, background, language discrimination, or social status. Next, we're going to discuss how you would communicate effectively and appropriately with patients and their family members and other healthcare providers within the scope of practice. The main goal is to build trust with other individuals to make communication more effective and efficient. There are several principles to follow when addressing patients and their family members, which are to focus only on the patient or the person that you are addressing. Make eye contact with the patient, introduce yourself, greet everybody in the room, and explain your role. You want to be personable in the conversation and be empathetic towards patients and their family members' concerns or questions. Be ready to educate them about the treatment plan or the agenda. Use pictures or diagrams to assist in medical discussions. Use language or terminology that the patient can relate to, and avoid medical terminology or jargon they cannot understand. Write down the names of new diagnosis, prognosis, and medications that will be given and of the new treatment plan. You want to demonstrate active listening. Active listening requires allowing the other person to speak uninterrupted and not multitasking during patient conversations, like typing on the computer or checking your watch. You want to use verbal and nonverbal cues to show that you are listening to the other person, such as head nods or responding with facial expressions or statements that show that you care for their fears, frustrations, and concerns. When speaking with other allied healthcare professionals, it is essential that there is mutual respect and that the information you convey, especially regarding patient information, is clear and concise. You want to use correct medical terminology, and you want to allow the other person to voice their opinions or ideas if it is a collaborative effort in patient care. Acknowledging their expertise shows respect for the other individual and is essential to intrapersonal communication. Next, we're going to discuss how to write a formal correspondence. When writing a formal correspondence, such as a letter or email to communicate ideas or important information, it is essential to write clearly and professionally. Start with using the sender's address, the date, receiver's address, and the letter's subject. Next, you want to use the correct salutation. Now is the body of the letter. First, one should introduce themselves and state the reason for the correspondence in the first paragraph. The second paragraph is for the information regarding the matter. When writing a professional correspondence, there are simple principles to follow. You want to use block format, that is, text aligned to the left and single spaced. Use appropriate fonts such as New Times Roman and not fancy fonts. Use standard rather than flamboyant or over empathetic language to convey message and avoid jargons, lingo, and abbreviations in the letter. Keep the tone polite and professional. Include only necessary information, keeping the correspondence brief and to the point. You want to ensure that you have proper writing mechanics and check for punctuation, grammar, or spelling errors. You want to reread the letter to yourself or have another person read the letter to ensure that you have the correct messages being conveyed appropriately. Never include the names of any other individuals or any other personal information without informed consent. These are easy steps to follow that to ensure that your letter is precise and professional.